Clamshells can be a great exercise. Notice how I said can. They can be a great exercise when you know who should have clamshells and how to execute them based off their biomechanics. And that's where the problem and the disconnect lies with the clamshells. It's typically randomly prescribed and given to almost every single patient as a means to improve weak hips. Well, in this two-part series, we're going to first break down the why. The why meaning the biomechanics to understand who actually needs clamshells. And once we understand the biomechanics, then we're going to go into part 2, which will be the next video. And we'll talk about the how, the execution. So we can start to link up the biomechanics to proper execution. The first concept to understand are the two archetypes. Now, these archetypes are one of the main reasons as to why all clamshells are not created equal. What I mean is that you will see different reactions from patients when they perform a clamshell, and that is usually a direct result of their biomechanics, which is based off their archetype. So it becomes really powerful when you understand these archetypes and the biomechanics so that you know what's going to be best for my patient? What exercise are they going to respond to? Which exercise should I select that's going to increase and improve their movement variability? Now, before we go into the archetypes, I find it really helpful to use cars as an example. And it's helpful for me to teach you as a personal trainer, physical therapist, physical therapy student, but it's also really valuable for you to use it with your patients. Because they're going to want to know why are you choosing this, right? What's your reasoning behind this? Why are you making me do this weird little modification, right? So if you can understand it and teach them, then you'll be able to understand it. So again, you continue to increase and improve your confidence so that you're always choosing the right exercise. Now, when it comes to cars, what I want you to think about is we have expectations, right? We expect that a truck is going to be worse on gas compared to a sedan. We expect that a truck is going to be able to pull a lot heavier loads compared to a sedan. They have pros and cons inherently, and the human body is the same. There's different archetypes, and they're going to have pros and cons. There's not one archetype you want to try to be. It's more so just that is expected, just like we expect certain things with cars. And we could keep going with cars. We could talk about cars that we expect to be fast, we expect to be slow, we expect to be big and have a lot of space, expect to be small. All these things are expectations because of the frame, because of the engine, right? And that's what's going on with the human body. So the two different archetypes are the wide and the narrow ISAs. Now, I've definitely talked about this on other videos. If you really want to dive deep, I would encourage you to check out the Performance Redefined course where we have 8 weeks talking about this so we really kind of get to that mastery level. So the wide ISAs, or infrasternal angles, are going to be ISAs that are greater than 90. They are going to have a nutated sacrum. And that nutation is going to then create them being better at internal rotation, adduction, and extension. The big thing here is that they're going to have more of an eccentric bias at that posterior lower pelvis. There will be more to come on that as we get into section 2. Now, for our narrow ISAs, they're going to be just the opposite, right? So it's going to be an ISA that is less than 90 degrees. They're going to have a counter-nutated sacrum. That counter-nutation is going to create more of an external rotation, flexion, and abduction bias. They are going to have more of a compression or concentric bias at that posterior lower pelvis. So we now understand a basic overview of the archetypes, but how does that affect our clamshells? That's where our archetypes and the pelvis come into play. I want to break down our wide ISA and then our narrow to show you why you're going to see these different results and different reactions from the patients you give clamshells to. So with a wide ISA, we already talked about the motions and movements that they're good at. We talked about how we have a nutating sacrum. That's when the sacrum tips forward. The innominate bones move into internal rotation, adduction, and because the sacrum tipped forward, it's moving back, which is also known as extension, right? For this video's purpose, I want you to understand that, but I want you to take your focus and bring it down here, the posterior lower pelvis. We have to start to respect and appreciate that when we go into nutation, that things, i.e. muscle, soft tissue, are going to have to expand. Nutation requires expansion back here. That means if someone can't expand, they're not going to be able to nutate well. So, what's the effect on that as it relates to the pelvis? Well, an eccentric or an expansion back here is going to place the muscles in a lengthened position. That length is going to create weakness, right? A long muscle is a weak muscle, a short muscle is a strong muscle. So our wide ISAs are usually going to have a harder time to feel the glute while you're doing a clamshells. They are going to have a harder time to understand what's going on. They may have to actually ER and abduct their legs significantly higher when they're on their side, right? Compared to some others that you may put them in a clamshell and they barely move their leg and they're already complaining, right? So that's all I want you to take away from this video, is that your wide ISAs are going to be in a lengthened or weakened position. That's going to cause them to have a harder time to feel the muscle during the movement. Now let's talk about our narrow ISAs, right? We talked about the basic overview. We talked about counter nutation of the sacrum. That's where we tipped back. The counter nutation is going to press and expand and move the innominate bones into external rotation, abduction, and flexion, right? Just like we saw with our wide, because the sacrum is tipping back, your innominate bone is relatively moving forward or into more of a flexed position. Now, just like we saw with our wides, with our narrows, I want you to understand that, but bring your attention and focus down to here. What's going on here? Well, it's just the opposite of your wides, right? Your narrows are compressed here. The compression is what's giving them the movement expectations and that counter nutation. When I say compressed, I'm talking soft tissue muscle. So what does that mean? Well, we are going to be in more of a concentric bias, right? A shortened position. So if you think about what we said with the wides, with the narrows, they are going to be the ones that really feel their glute. They're typically the ones that you're like, yeah, are you kind of faking that because it's so intense, right? They go into the clamshell motion, AB and external rotation, and they start to freak out when they barely lift their leg. That's because there's so much compression there, and then you're adding more compression, right? And it's just too much for them to handle. That will be it for part one. I know I'm leaving you on a little bit of a cliffhanger. Today's focus is all about the why, the concepts, the principles. Part two, we are diving into the how. But try to really understand the concept so that when we go into the how, you know the exact reason for the modifications. I also encourage you to subscribe and like the video if you find this content valuable, and I will see you guys in part two.